Kia ora koutou, greetings. This presentation was on the suicide behaviours and mental health of secondary school students, and this report, which has been funded through Te Pou, has been made available. This is one of a range of youth surveys, and it's all there for you in terms of the information from secondary school students about their health and well-being, but in this report specifically around suicide and suicide behaviours. I guess there's a number of things in that report, but a few to highlight on, and it's really interesting. I'm a clinician, so I work in a child and adolescent mental health team. So this is about population surveys, which is always sort of interesting. You know, I'm actually much more curious about treatments, obviously, because I'm working with clients and young people and their families, but here we've gone out and surveyed the population. So this is a random sample of secondary school students, and I guess the thing about a random sample is it's very different to the clinical sample, and I was really interested in, Emily and the DBT's struggles to recruit, suicidal young people or self-helping young people. When you see the numbers in the report, when we randomly survey secondary school students, it's about 7 to 8% have said in a confidential anonymous survey that they've tried to kill themselves in the last 12 months. So that's 2 or 3 per classroom. There's thousands of young people in New Zealand who are self-harming and who are suicidal. So I think this is where some of the value of population surveys can help us, because of course, if you're trying to develop treatment service for that many people, we're never going to do it. It's impossible, let alone how can guidance counsellors see all those young people. It's an impossible task. So while we have treatment services and we need to study treatment and to get those, as best we can, so they reach the people with the highest needs and deliver services that are effective, and we also need to be aware of this bigger context. And in this survey, you will find some of the data about what are some of the risk or protective factors. And I guess in this field, when we talk about those, we're talking about factors that either increase the likelihood of young people engaging in suicidal behaviours or decreasing the likelihood, because at a population level, perhaps those are some factors we can do something about. Now, this is great, actually. I can talk about other things, because I'm really keen on this idea of, we've been really pushing access to services and quality of services, but I am keen that, that's just one part of reducing the burden of suicide behaviours amongst the population, that there are a whole range of other factors, and often they've ended off the table. And I guess these would be more the health promotion type of factors. Whānau Ora, I think, has the concepts and the ideas there have enormous potential to improve outcomes for young people, which I'm interested in, but also the other parts of the population, because it's talking to positive connections, it's talking to resiliency within families, problem solving, capacity, and community development, which I think have to be some of the factors that need to be addressed, given the challenges of service delivery and the models we have around that are never going to be able to be there for all the people who engage in these behaviours. The second thing I want to talk about, now that I've got the opportunity actually, is engagement with the media. And this idea of how we talk about suicide and suicide behaviours in the media, I think is a really topical, interesting issue. And we're spending quite a bit of time in our field thinking that we do want to talk about this stuff and dispel these myths that somehow we can't do it. And I know that Spins and other researchers and Te Pou and people are also engaged in this. So this idea that there are these media guidelines which are preventing the media talking about suicide and putting a lid on it, and then there's hidden agendas, I think we need to dispel. And I think one of the ways to do that is that we all need to be saying, yes, let's review the media guidelines, because I think unless we do that, somehow we'll be seen as being complicit with this secrecy of silence. So I would strongly advocate that we support the Prime Minister and others who say we want to review the guidelines, and we put it on the table again and we talk about it. The challenge with the media, from my point of view, is that, we do know some of the things that raise the risk, particularly of what the media call copycat, we often call contagion suicide, particularly amongst young people. And there's good international evidence, been lots of studies that show that what we don't know and we don't have much evidence about is what actually is helpful discussion in the media. So, on the one hand, we've got good evidence of things that create problems. On the other, we don't have much evidence about what's good. But I think we have to use our instincts, our intuition, our idea that, we'll go with the things that we want or we think will be helpful. And I think at times we've been a little bit maybe ambivalent or even a little bit scared about doing that because we've been so fixed on this concern about risk. But I think we do have a clear idea about that now. It's pretty well identified what are those features of the types of reporting. And of course, as the Prime Minister's been saying now, there's all this new media, social networking. How do we deal with that, And the ideas, particularly amongst young people, about how these messages get through Facebook pages and, about what's happening, I think is something that we need to start thinking about. So that's going right off track. The good thing about, I think, the findings in the Youth 07 survey were that we have now got a monitoring tool, by which I mean a good survey that is anonymous and confidential for young people, that has been repeated over 2 time periods. So we did it in 2001, 2007. The data out of it looks promising in terms of mental health and suicide, because the suicide attempt data and the plan data and the thought data is all reduced over that time period. That's a positive finding, and as well the measures of mental health like depressive symptoms have reduced. So that all seems like it's heading in the right direction. I would also say that the rates of young people who are engaging in those are still really concerningly high. So it's not like let's pick up and go home. The other thing is that over that period was a period of real economic boom. And it's going to be really interesting to what happens now through a recession and other changes. And the good news that I can share is that it's looking really likely that another survey will be funded and will be done within the next couple of years. So we'll have another measure of how this group of young people. So the hope is, of course, that this data becomes part of a rolling series of surveys that monitors the health and well-being of young people over time. So that'll give us an idea of some of the changes going on within this population group. I think I might leave it there. I mean, there's heaps of possibilities for questions, I suppose, given if people have queries about the youth survey or the data that's come up. But given the time and the lack of slides and people's need to have Kai, I think I'll shut there. So thank you.